Good evening, everybody. I'm Jason Iasatis. This is my show again, Outside the Box. More and more inside the box as time goes by. Tonight, I got a fantastic guest. Very appreciating him coming on with me, Dr. Andrew Kaufman. Thanks, Andrew, for joining me.
My pleasure to be here, Jason.
And thanks for all your fantastic work, which I've been watching very closely. Really nice to hear someone talking about this in a very level-headed way with facts. It's great, you know. Just give you a quick bio. You're professor of psychiatry, forensic psychiatrist, doctor of medicine, natural healing consultant, highly qualified molecular biologist. So you're listening to the right guy, people, you know. And you work with cancer, which is interesting, knowing about that cellular thing. You know, I asked Dr. Andrew if I could open up with a little clip. I'm hoping it'll work, from a doctor which I found, who was talking about he was being told to rig the numbers, literally. And it's very, very frightening what we're looking at. Andrew's going to tell us a lot of truths here tonight. And because there's no doubt that the people are dying of cancer is being used as coronavirus instead. And we'll go into the nuances of that on the show. You know, people are dying and they're banging the coronavirus on the death certificate, which we're going to talk about a lot now. But can I just play that clip quick, Andrew, before we start?
Yeah, please do.
Thank you, because I think it'll frame the conversation. I hope it works, so we'll see. If it doesn't, it doesn't. And we'll just go back.
You just said, I think is critically important. Can you repeat what you just said, please?
Well, last Friday, I received a 7-page document that sort of told me that if I had an 86-year-old patient that had pneumonia but was never tested for COVID-19, but sometime after she came down with pneumonia, we learned that she had been exposed to her son, who had no symptoms, but later on was identified with COVID-19, that it would be appropriate to diagnose on the death certificate COVID-19. Now, we've not done that. If someone has the pneumonia and it's in the middle of a flu epidemic, and I don't have a test on influenza, I don't diagnose influenza on the death certificate. I will say this elderly patient died of pneumonia.
I don't mean to interrupt you, but my heart is sinking right now as you're telling me this. You're a doctor. Why in the world would they be sending you out information to fill out death certificates, whether the person's been diagnosed with COVID-19 or not, but then to say in the death certificate this person's death was caused by COVID-19? That does not sound right to me.
I went to the person in our office who does most of the death certificates over the last 10, 20 years, and I said, does this sound right? I had her look at the documents that I printed off, and she said, well, we've always been told that you always put down just facts. You don't put down any probabilities. You don't put any presumptions down. It's just what you know. And so this is concerning, and it actually gets to your point, Chris. When we start talking about the data that goes into the modeling, we have to ask ourselves a question. Are we being forthright? Are we sharing with the public? Minnesota, North Dakota, we don't need to be having it sugar-coated. We want to know what's going into your modeling.
So with that being said, why would they want to skew the number of deaths due to COVID-19?
Well, fear is a great way to control people, and I worry about that. I worry that sometimes we're so darn interested in just jazzing up the fear factor.
Thank you very much for your patience. Thanks, Andrew, for listening to that. And
welcome. I couldn't hear it.
Oh no! I hope we can hear it on the show. I really do hope we can hear that, or I'll just cut the whole clip out. But it'd be a shame if we can't. That's a pity. But I hope everyone heard that. But if everyone did hear that, it might be a good segue, as transition for Andrew to talk about the CDC and what they say about different things. Andrew, I'll hand over to you. You know, thank you so much for your great work.
Oh, it's my pleasure. And, I think what the person was talking about has to do with the death certificate reporting and how they collect the statistics to see who has actually died of this virus, alleged virus, COVID-19. And there are several issues that introduce a lot of error into this data collecting. So some of them just have to do with the testing itself, because the testing has never been validated against a gold standard, and a gold standard is where they would actually measure the virus. The test doesn't measure the virus, it measures genetic material, which can be is a separate thing and may not be nearly as accurate. Some preliminary studies have shown a false positive rate up to 80%, but those are estimations because since there's no gold standard for comparison, it can't be, an error rate can't be calculated accurately. So in other words, we don't even know how accurate the test is because we can't calculate that because there's no basis of comparison. So it's really quite ambiguous what it means. And even if you did accept that it does test genetic material that is from a virus that's exclusively found in people with this illness, even then, according to the CDC, it cannot differentiate between someone who has the virus in their body versus someone who has a disease from the virus, right? So we might be familiar with other so-called virus diseases like hepatitis C. And they do a test called a viral load, which is also a PCR test, by the way, but it's a quantitative rather than qualitative. So the COVID-19 test is just positive, negative, that's qualitative. The quantitative PCR used for hepatitis C gives you a number of viral copies. So it tells you how much of the so-called virus is in the body. And when those levels are low, but they still show a presence, well, then that's not active disease. And then when the numbers are high, then they say, well, now the virus is active and it's damaging the liver. So the current test doesn't differentiate those two conditions. So you could simply have it, but it's not actually causing an illness and still test positive. And that is right on the CDC's website. So aside from just the inaccuracy of the test, there's also the problems with how do you report this on a death certificate. And, you know, when I was trained in how to fill out a death certificate, you're supposed to write what actually caused the death. And many times, you know, when you're taking care of a patient in the hospital, you know what they're sick with. And so you usually know what caused their death. Like, for example, if they have a heart attack, right, that caused their death. And there may be underlying factors that increase the risk of that, but that was clearly what made their heart stop, which ended their life. In the case of COVID-19, it's much, much less clear. So like I said, the testing is inaccurate. And also the symptoms and the clinical presentation, in other words, having essentially pneumonia, right, with respiratory symptoms and findings on a chest X-ray or a CT, those are all non-specific findings. So they could be positive in a number of illnesses, but most commonly just regular old bacterial pneumonia or regular old flu. And in fact, we know that those two illnesses have caused substantially more mortality than the COVID-19 virus, even so far this year. But no one is really, considering that too much. It's important to have comparisons, and that's even with the potential over-reporting of deaths from COVID. So I have this document from the CDC itself that they put out this month in April, and they actually had a preliminary version of it. They put out March 4th, and this is the final document, and it's called the Guidance for Certifying Deaths Due to Coronavirus Disease 2019. And in this, the CDC is basically instructing us to attribute almost any deaths with a respiratory illness to COVID-19, even if there's not a test that's positive, even if we don't know. And so I'll read you just some language because it's very telling how this is their own document, their own words, not my words. So they say, when determining whether COVID-19 played a role in the cause of death, it says, where possible, conduct appropriate laboratory testing. So in other words, you don't need to perform appropriate laboratory testing in order to make that determination. It goes on in the next paragraph to say, if the COVID-19 cannot be definitively diagnosed, but it's suspected, so just it has to be suspected, it's telling you that you can report it on the death certificate as the cause of death.
Amazing.
Okay, so all you need is suspicion.
Wow.
To report this. It's pretty incredible.
It's incredible. It's a shock.
It says it's acceptable to report COVID-19 on a death certificate without this confirmation. In other words, without testing, if the circumstances are compelling with a reasonable degree of certainty. That's not very much certainty. In fact, when I sometimes do work as an expert witness, and since I do this and mostly related to psychiatric and mental health issues, which is, there is a margin of error, certainly, because it's not like other areas of medicine where you have a definitive gold standard test. You know, like for example, if I take a sample of your blood and put it under the microscope, I can actually count how many red blood cells are there. And I can measure the size of the red blood cells, and I can measure the color of those cells, right? And I could reproduce that 100 times over, no problem. And that will tell me definitively if the person's blood is anemic, right? So there's no doubt, there's no reasonable degree of anything. It's simply either it's there or it's not there. And so what I have to testify is a reasonable degree of medical certainty, which is generally considered to be 51% likely. So what the CDC is saying here is if there's a 51% chance that it could be COVID, even if there's no testing, then put it down. So you could see that that could inflate the number of deaths attributed to COVID-19 by a factor of 2. So it could make it twice as likely, it could make it seem as if twice as many people died as the reality might show, but that's just one section, because the other word about suspected, having suspicion, that's much lower burden than 51%. I would say suspicion is maybe 10 to 15%. So then there could be a 6-fold inflation of the reported numbers versus the real numbers.
Wow. Hey, look, you can only say wow. Let me just say this to everybody. This is a doctor here. Listen, this isn't some conspiracy theorist lunatic I've got on the show, right? Let's get that clear here. And you know something, how many people died?
Jason, let me add one thing, because, you know, even if I weren't a doctor, anybody can go on the CDC website, cdc.gov, and find this document and look for yourself. I mean, this is written in regular language. It's not like a scientific paper, which could be very challenging to understand, but this is plain and clear. You know, it's saying if you have suspicion, then put it down.
Fantastic. Thank you, Andrew. And I'll just say, listen, to everybody who's been having a little go at me and saying how it's a very bitter pill for people to swallow in any area of life and history, that they may just have been fooled. Look at Iraq. Colin Powell with that little thing. He's got weapons of mass destruction. They knew it was a lie. That's a fact now. Anyone can prove it. Tony Blair's still walking around. Over 1 million people killed on that lie, because they wanted to go in and take over the Middle East. Now, that's a fact. 66 million people in Britain now under house arrest, lockdown, quarantine, right? You mentioned this with Jamie. They're under quarantine, and they're not, if they haven't even got a virus, right? People walking past each other like this. Listen, everyone, let me tell you now, you don't get coronavirus, if there is such a thing, from smiling at someone or looking at someone. People won't even look at me when I go past, right? So listen, it's very, very, it makes people angry when they might just think that they might even be fooled, right? You know, many people die of pneumonia. I was with my father in hospital many times. He had pneumonia. He died in the end. Terrible situation. But listen, so many people end their lives with pneumonia. How many people are having the death certificate, you know? And, you know, with your permission, I'll just mention what Fauci said. Can I say that, or do you want to say that, what you mentioned? I thought that was astonishing. Dr. Fauci, a stooge of Mr. Bill Gates, in my opinion. Yes, I'm ranting. Yes, I'm blooming upset about this. We've all been locked up. Okay, so Fauci, he had 2 different statements. This is Andrew's investigation. 2 different statements. Two different audiences, actually. One audience, which was the editorial he wrote for the New England Journal of Medicine. This was fascinating, Andrew. This will help people understand it. He wrote an article for the New England Journal of Medicine. Sorry to be stuttering. That audience was doctors. Okay. Can I repeat my plumbing? Most likely, this COVID-19 is no worse than a typical flu. Listen, everybody. Fauci said it's likely it's no worse than a typical flu and will have a mortality rate of around 0.1% or 1 in 1,000 people. I think that was your words, right? Okay.
Correct.
So there is that, right? The same snake in the grass, then speaking to the members of the public who he knew are very, very malleable and easy to terrify, right? A day or two later at a White House press conference, he didn't mention, but he said, we are headed for a big rise in the number of cases and mortality, and we need to extend the martial law measures for another 2 weeks or months, you know, it's like incredible. It's absolutely incredible. And he's been in the pocket, joined at the hip with Bill Gates, you know, lots of money going around. And just so everyone can just hear this about Bill Gates, 7 companies, Bill Gates, this is my conspiracy theory. He's talking about it on the video. You can see it on YouTube. Bill Gates, he's got about 7 companies. We are all trying to make a vaccination for this. That's why I think they're holding people back in more fear until the point where they just can't stand it anymore. And then he said, we're willing to lose billions, right? In my inverted commas, for me, to make trillions and control of all of humanity. We're willing to lose billions on the failures, you know? And Bill Gates, I think he painted a coronavirus fact last year, ready to do this, pumping millions into it. Wow. This is amazing, people, you know? This is amazing. Carry on, Andrew.
Well, you know, it's interesting that a lot of people are talking about Bill Gates right now, and I happened to see a speech that he gave at a conference just a year or two ago, and he made the statement to the effect of that through the promotion of vaccines and family planning, he hoped to reduce the entire world's population by 15%. And we're talking about, you know, something close to 1 billion people.
Wow.
It's pretty incredible. So, you know, I just wonder what is it that exactly is his agenda with this. But I've heard that has been funding all 7 of the companies that are trying to race to create a vaccine for COVID-19. And certainly, you know, that's something that it's very difficult to fathom, because if you haven't actually proved that there's a virus that caused this illness in the first place, well, then how are you going to design a vaccine to treat or prevent it if you don't know what's causing it? So I don't know what they're using to design the vaccine, other than some of the misleading information from some of these initial scientific studies. And I'd be happy to talk about those a little bit if you like.
Yeah, please, if you could. I've got a quick question before you do, right? Before you go into the exosomes and all, there's lots to talk about. But let me ask you this, because I saw this on one of the comments on Jamie Ike's interview with you. Fantastic talk. Thank you for that. And thank you, Jamie, for your great work. And thank you, David, for your great work. And Gareth, his other son. Listen, one of them said, and I don't, this could be complete codswallop. And it just, a light went off in my mind, because apparently there's lots of coronaviruses in people's blood anyway. I don't know, you'll tell me, you're a doctor, or COVID or whatever it is, you know. I want to ask you this. Someone said on there, hey, just a thought, over everyone's having flu jabs, millions and millions of people having flu jabs. My own family's free. They queue up there, rushing to roll their sleeves up. In the flu jabs, don't they inject you with all sorts of coronaviruses in that flu jab, Andrew? And could that be what they're picking up in these tests, or not? I'd love you to say yes.
I mean, I certainly do have some thoughts about what they might be picking up in the tests. And I actually did consider vaccines, because you are correct in that most vaccines actually do have genetic material. And, you know, the COVID-19 test is a test of genetic material, specifically a piece of RNA. And it's been well documented that vaccines have DNA from fetal cell lines and perhaps other cells. But in the influenza vaccine, I'm not aware of any coronavirus genetic material. But I will tell you that there is really no studies that show that the flu vaccine prevents any flu, but there is a study that's quite interesting that shows if you get the flu shot, or the flu jab, as you call it, where you're from, 3 years in a row, that it actually increases your risk of getting the flu subsequently. So there's definitely something not right about the flu shot. But coronaviruses, you know, they taught us about these in medical school, and they said about half of the time the common cold is due to a coronavirus. So you know, they've also told us that there's lots of varieties of this or strains of it. And you could tell that they came up with COVID-19. I mean, they may have chose that number for a variety of reasons, but certainly it tells you that there were at least 18 other coronaviruses that came before it that they characterized in some way. So this is not a new thing. There are other outbreaks that have occurred that they've blamed on coronaviruses, such as a previous SARS outbreak and the MERS, which is in the Middle East. So, you know, they've known a lot about coronaviruses. There was also the big planning simulation event in November at Johns Hopkins University that was also, I believe, sponsored by Bill Gates, called Event 201. And this was like a, you know, big interdisciplinary conference where they were planning out scenarios of how they would deal with a large pandemic. And of course, the model they used was coronavirus. And this occurred just 6 weeks before the initial patients or people got ill in Wuhan, China.
Where was that conference? Do you know where it was?
Yes, it was at Johns Hopkins University, which is one of the most prestigious medical schools in the United States.
Is that the one where that guy Neil, what's his second name? The one who predicted all this, there was going to be 500,000 deaths, and that's why they had the lockdown. Neil, not Armstrong, what was his name? Can you remember?
I don't remember that particular doctor's name, but I'll tell you that the way they have made those predictions is based upon computer simulation models. And these computer models, they're using what's called an exponential expansion. So in other words, let's say they believe that there's a certain incubation period, right? Like, let's say 7 days or 14 days. They don't really have actual data on this because they haven't measured the virus directly. So they're just kind of making it up. And then they say every 7 or 14 days, the number of cases doubles, right? So if you double things a few times, the numbers get really high, really quick. Right, and in fact, that's exactly how the PCR test works, which is the diagnostic test. So they're using exponential functions actually a lot in this analysis. And with that, if you do that PCR test like around 45 times, so you double it 45 times, even if you start with 1, you're up into the quintillions. So you could see that it would really inflate the rise in number of cases and number of deaths, and it becomes very scary. If you know, right now there's really almost no new cases at all in China, right? So you sort of have a complete curve looking at the epidemic there, and so you can put that on a graph, and that would be the closest thing we have to real world data that might predict how things might progress in other countries, you know, and it's nowhere near an exponential rise. So the fact that they're using these models, which can, you know, easily be tweaked. I've played with computer models myself, and they're just not accurate. It's basically just a tool to generate hypotheses. It's not supposed to be used to make predictions. It's not supposed to be used to prove anything scientifically. And in fact, there's yet a third example where they use computer modelings in this whole pandemic scenario. And that is related to this practice of social distancing. So there are a couple of real world studies on that, but they were so biased that in a review article in the BMC Public Health Journal, the author said that you can't even report the results really because the studies were too biased. So all they had were some computer modeling studies. And of course, the computer modeling studies showed that it prevented disease transmission, and it wouldn't have been published probably if it didn't show that. So, but it's, like I said, it's very easy to adjust various parameters or, you know, tweak the model so that you can get the desired outcome, because there are many variables that just you don't have real world measurements, or maybe you don't even know there are variables that influence it. And so you don't take those into account at all, or you just guess at what they might be. And that's where all the error comes. So it's a very useful tool for, generating a hypothesis, and then from that hypothesis, you could design a real world experiment to see if something is true, either prove or disprove your hypothesis. But you can't use it to set policy for the entire globe when you're shutting down the economic system, when you're putting people under house arrest in their own homes, when you're alienating people from each other. And all these things are going to have devastating long-term consequences. It's not just that we buckle down for a short time. I mean, I see people are losing touch with each other. They're learning to fear each other, right? And lots of businesses are going bankrupt and are not going to be able to rebound from this. So it's just kind of insane in a way to see that just based on a computer model that someone could guide to any outcome they want, they're making policy for the entire planet.
Well said, Dr. Andrew. Thank you very much. And I just forgot to say at the beginning, thanks for being taking responsibility as a doctor. I really mean it. So many people don't speak out against the truth if they're doctors, particularly because they know there's going to be repercussions and they'd be slam dunked. Even people in the lower echelons of the medical world are scared to come out and say anything because they know if they do, or even like or repost something on Facebook, because their current employer or a future employer might see what they're doing. I really respect your work. Thank you. I've remembered the name of the chap, the delightful chap called Neil Ferguson. That was his name.
Yes.
He predicted 500,000 deaths. Whoa, my God, Boris Johnson, lock everything down quick, you know. And then he brought it down to 20,000. Oh, so we don't have to have a global meltdown then, you know. It's like people aren't going to starve to death in Africa, are they, or India, because you've just said 500,000 and it's gone repercussions right around the world. And then 2,700, I think, is going to adjust. Oh, that's all now. It's fine. Everything, it's okay. People's mums and dads are going to die. You've got to say goodbye on Skype if your mum's dying. This is crazy, you know. If somebody...
Well, you know, Jason, what happens when you make bold predictions like that, right? If I made a catastrophic prediction, everybody would, panic and do whatever they could to protect themselves, right? And then a few weeks later, it turns out not to be true. Instead of saying, we got to get that guy for lying to us, they say, thank God it's okay. Thank God I'm still alive, right? Just the relief. So it's a pretty low risk proposition from that point of view. And, you are right to point out that for me, I am taking a lot of risks coming out and publicly, and even many of my doctor friends from the past have, been very upset with me and written me off. And I know the real reason is because if they opened up their eyes and started looking at things and figured out what really seems to be going on, they couldn't continue to practice medicine in that way, and that would turn their life upside down. So I'm lucky that I have, been on a process, a journey, since I've started looking at some things about medicine and realizing what's actually going on, that I've taken, a step-by-step approach to get out of that system. Mm-hmm. And I still have one foot in the door, but I know that I could be pushed out, certainly. And I've definitely been called some names recently, but overwhelmingly, people have been very supportive. And many doctors and scientists and nurses and lab technicians and paramedics and EMTs from all over the country and Europe and have reached out to me and thanked me. They've asked for more information. They want to learn more. They want to do their own research. Some people have even offered to help my research efforts. So it's really been, overall, I just know that this is what I have to do, because my mission is to, help people to learn about what's really going on so they can figure out what to do for themselves, how to make their own choices of how to deal with this situation.
Well, thank you very much. And like you said, you might get shoved out, and I'm sure you've got your parachute on ready, But do you know what? It's definitely going towards the China model. That's no doubt about it. Look, people know about my rantings, I'm someone who looks at everything, all sides. There's no doubt there was a huge global awakening. The smelling salts was clearly under people's noses, more and more people waking up. And that's why I respect you as a doctor, just like I respect Bruce Lipton, who's done some stuff for us before. He's been on my show. You can see a good chat I had with him just here, actually. We were both sat in a room not far from here and just talking about different things. And he's the same. He's people are coming out more and more and more and more now. And, you know, that's why I respect Brian Rose, because he often just talks about just the very, you know, just talking about consciousness and power and stepping in your power. And Brian's now had the courage, Brian Rose, to come right out and say freedom of speech is everything. And he's put his whole future on the line for speaking with David and having that massive frank conversation about different things. But this is the way I discovered your work was through David, actually, and a couple of other people, when you started talking about exosomes, you know.
Yes.
Can you talk about that? So that's the crux of really, wow, listen to what Andrew's saying. This is fascinating stuff, you know. And can you go into that? And my apologies to you, Andrew, because you've got to tell people about this. You know, I say that to guests sometimes. I'm really sorry you've got to keep talking about this, to keep putting the smelling salts under people's noses. You know, my grandfather used to have a little brown bottle with cotton wool in it, and he'd put it under our nose, and you go, oh, you know, it was like some kind of old smelling salts. And that's what people are getting a whiff now. It's like, hey, what? No, what? You know, so could you go on about that a bit, just to explain to people what those breakthroughs are, which are absolutely fascinating, groundbreaking?
Yes, absolutely, Jason. And, you know, let me tell you that, you know, before this thing started to get out of control, I wasn't really primarily interested in viruses and exosomes. This is something that I have thrown myself into, you know, only because I want to find out what's going on in this situation. But I've read so many papers, and you know, I'm really starting to learn the entire body of research in this field. And so I was listening to another physician, actually, who's been outspoken about this, Dr. Tom Cowan, and he gave this talk where he mentioned exosomes. And as soon as I heard that word, it was like a ding went off in my head. And I had recalled years ago when I was studying a lot of molecular biology that I had heard about exosomes and how they're just like viruses. So I said, you know, I have to dive into this. And I had this idea that, you know, could they have actually mistaken this virus for an exosome? And I started digging into the literature, and practically every article that I came up solved another piece of the puzzle and allowed me to put this together. So I'll tell you what exosomes are and how this whole thing came about. And, you know, also I want to say that when viruses were a theoretical construct before any particles of that size were ever seen under a microscope, because the germ theory had become the prominent paradigm around the turn of the century or late 1800s. And they discovered various types of bacteria present in certain illnesses, and they attributed those bacteria to causing those diseases. But there were still some diseases that they couldn't find a bacteria. So they said, well, there must be something else there, some other kind of organism, we just can't see it. And then the electron microscope was invented. And that's a very powerful technology that allows you to see a much higher magnification. And once they started looking under there, they saw these tiny little particles, and they called them a virus. But the thing is that they were already looking for something that causes disease. And so when they saw them, that was the primary conclusion that they came to, is, oh, that must be this other infectious agent that's causing disease that we haven't been able to see before. They didn't say, like, oh, there are these particles that we've never seen before. I wonder what they do. Let's do some experiments to find out, right? Instead, they said, oh, there's the virus that we've been looking for. Let's prove that it causes disease. And they actually had a set of proofs of steps that were lined out by Robert Koch, who is a microbiologist and physician, a big name in germ theory, and just these 4 simple rules of how to prove that a virus or a bacteria or any other microorganism causes a disease. And it's very common sense. You know, it's basically you have to identify a disease that has a common set of symptoms. And then when people who are ill with those symptoms, you can, from the disease part of their body, isolate and purify an infectious agent. And you would also, by the way, look for that agent in healthy people without those symptoms, but look in the same part of their body, and you should not be able to find it. Because if it's present in healthy people and sick people, obviously it's not causing the illness. And that's called, by the way, a negative control. So you have to show that negative control in order to know that what you're seeing in the group of sick people is really there, right? So for example, if you just, let's say that you wanted to say that nose hair was causing a disease, right? Well, you'd have to have sick people that have nose hair and healthy people don't have any, right? But since we all have hair in our nose, then you can't reason that it causes a disease. So this was never done for any virus that causes an illness. And that they never show that it was present only in sick people and that they could isolate and purify it from only those sick people. And to really conclusively prove it, after you isolate it and purify it, you would have to take the particle or agent and put it in a healthy person, and it would have to cause the same illness. And that's really the proof positive of the causation. There's a lot of science that is built around associations between things or correlations. In fact, in New York City back in the 60s or 70s, there's kind of a famous newspaper article that came out because they had a major heat wave one summer. And so the headline read, "Ice cream causes violence." And what happened was it was a heat wave, so the ice cream sales was very high. And also people were on edge because they were uncomfortable and they were getting into fights, right? So they were highly correlated. Like if you even calculated something called the correlation coefficient, it was really high. It might've been like 90% or something. But it's very clear that the cause was actually the heat. So the ice cream didn't make people violent, the heat did. They had a common cause. And I think a lot of the confusion about various associations here has to do with that there's a common cause of things, not that this association proves cause. So if you happen to see two things together, that doesn't tell you that one thing causes the other. And that's why you have to take this agent that is associated with sick people and show that it causes disease in a healthy person. And of course, this could be even done in animals. It doesn't necessarily have to be done in humans, but it hasn't been done there either. So if we fast forward a bit to about 30 years ago, some scientists discovered that there are particles that look exactly like these particles that they have been calling viruses all the time, that actually come from our own cells, from human cells. And I want to just add that when they did this initial research with the electron microscope, at that time they weren't able to understand genetic material and sequence genetic material. The technology wasn't there yet. There was no PCR test that was invented in I want to say the late 80s or 90s.
What's a PCR? Sorry, what's a PCR test, Andrew?
Yeah, that's the test that is used for the COVID-19 diagnostic test. It stands for polymerase chain reaction. And it's the one that doubles and doubles and doubles the genetic material so that you can detect it. So they discovered exosomes about 30 years ago, right? And are virtually identical to viruses. But they come from our own cells. So this was quite an amazing discovery. And since that time, there's been a lot of growth in the research publications in the field of exosomes. And there are many, many papers actually that discuss the similarities. And in fact, there are some very prominent virologists who say that they're the same thing. So, I wasn't the first one to have this idea, but what I did was apply it to the COVID-19. And, one of those famous doctors is named John Hildreth, and was an HIV researcher at Johns Hopkins, and he's now the CEO of another medical school. So a very well-respected and prominent scientist. So what I did was I looked at the paper where they allegedly, discovered that this, novel coronavirus, they called it, which later became known as COVID-19. And what I found was some pretty poor scientific methods. So remember, I was talking about the importance of having a negative control. Well, in this group, in this study, which I think so much is based upon of our knowledge today, they had no negative control at all. So I had a group of 7 people who exhibited the same respiratory symptoms and fever and laboratory values. They basically had pneumonia of some sort. And only 7, that's very few people. And interestingly, only 5 of them actually showed the genetic material which this diagnostic test is based upon. So 2 of them didn't even have it, and yet they still had the same symptoms. But they did not test 1 person who was healthy. So why would they not do a negative control? It would be quite easy. It's definitely a standard. I mean, if you were going to get a test or a drug approved by the FDA, all they would want was controlled trials. If the trial doesn't have a control group, they would just put it right in the trash. I wouldn't be able to publish any article without a control group. It would be rejected immediately. In fact, I mean, they would say, why did you even bother submitting it? So why do we have this paper that is basically the original proof that all of these tests, all of this policy, all of the economic crash, everything is based on, and it doesn't even have one of the most basic design principles for any scientific experiment, a control group. So there's more shoddy science in this study. Basically what they did is they took lung fluid and they put it with an enzyme that digests any membranes, so that if anything is inside of a cell, it's free in the solution now. And they just found some RNA and sequenced it and said, it's a coronavirus because the sequence is similar to other coronaviruses. But the thing is that the experimental evidence for the other coronaviruses is virtually of the same poor quality. So it's like poor quality based on poor quality, based on poor quality, based on poor quality. So it's really hard to tell if that means anything. There's many, many sources of genetic material in your lungs. And one of those is from exosomes themselves. And it could be from your own lung cells. It could be from the hundreds of different species of bacteria or fungi that live in our body. So there are many, many sources, and there's no way to know exactly what the source of this genetic material is. So they claim that they isolated this virus, but they did not do that in terms of their methods, because, and they do have some pictures that I'll show you in a minute. But essentially what they did is they mixed this lung fluid with a bunch of cell culture cells. And the culture cells they added antibiotics to. And antibiotics are toxic to the cells. So when cells are exposed to toxic materials, they make exosomes. And the particles that comes from our own cells that looks under the microscope just like virus particles. And so how do you know that the particles they're showing in the picture are exosomes from those cells exposed to a toxin, or if they're a viral particle that comes from outside of us, right? There's no way to tell. So what I did was I looked at what are the physical and chemical properties of exosomes versus what they say are the physical and chemical properties of the COVID virus. And I looked at the photographs of the microscope images that they presented in this paper and a couple of other papers that were even smaller. And if I can, let's see if I can share my screen here. I'd like to show you a couple of these pictures. Okay, can you see that?
Yep.
Okay, so on the left side, you'll see this is a picture from an electron microscope of exosomes. And let's see, can you see my cursor?
Yep.
So this is a bunch of exosomes that have emerged from the cell, like been basically secreted from this cell here. These things that say MVP, these are the where the exosomes are stored before they're secreted from the cell. And you could see basically a spheroid type of structure with a clearing in the center, and then these round granular globules around the periphery. Okay. And then if you look at the slide to the right, and the slide to the right is a little bit sharper because they made this section a little bit thinner. And this kind of microscope and the camera have a very shallow depth of field, so they can only focus on one plane. And if you don't get the tissue thickness just right, it looks a little bit more like the image on the left. But if you look at the image on the right, you see that it's the same kind of spheroid structure with clearing in the center. And then around the periphery are these dense, round, globular structures. Okay, so it has the same exact morphology, the same characteristics, and it's about the same size. And I know the scale here shows 0.5 micrometers here and 500 nanometers here. Those are the same number in different units. Okay, so these are essentially, you can see it's the same size, both has the same characteristics and virtually the same appearance. So I'll show you another picture here. And so here I have, this is what the MVE or the MVB, so this is inside of a cell. This is the image I'm highlighting here is increased magnification. But you could see that there's a circular spherical structure, and these are the exosomes inside. And this is from a nerve cell. And then here on the lower left, this is inside of, I'm not sure, this is one of the cells they used in the culture. So it's not a lung cell from the host, it's a cultured cell, but you can see inside of it, this spherical structure with these globules, and this is called COVID-19. So you see that they're virtually identical. So when I compared some of the physical and chemical properties between exosomes and COVID-19, I found that they were virtually the same. So the same size, as you can see, and a real key property is that they had the same receptor. So when our bodies secrete these exosomes, they actually serve a helpful function. So they help us heal from some kind of disease or poison. And they are capable of actually gobbling up poisons. And they also have a communication role. So they would be secreted from, let's say, you know, a cell in your lung where there might be some illness. And then they would go through your blood and wind up maybe in your bone marrow to tell you to make more white blood cells, for example.
Wow.
Okay. And so they'd have a special key on the surface of the exosome. And that key would fit a lock somewhere. So it would go around the body through the blood looking for that lock. And then that lock would be on the bone marrow cells. And as soon as it found the right lock, it would engage and unlock and then share its information with that target cell. Now, the virus works exactly the same way. It has a key, and that helps it find its target cell. And this is what we call this a receptor in biology. And you can see, that the receptor here, they both have been shown to have the same exact receptor, which is the ACE2 or the angiotensin converting enzyme 2. They both contain the same type of genetic material, RNA. And there are studies that show that exosomes also are found in the lung fluid, the same as in this COVID-19 study. So you can see from the degree of similarities in these structures, and taking into account some of the statements by experts, as this is Dr. Hildreth, who I mentioned before, what he says, that how do you know that what they're calling COVID-19 is not simply an exosome from our own bodies? So this is my hypothesis, and there seems to be just so much in common that you know, how do you know what's what? You can't tell from the experimental studies, and it's quite compelling.
Oh, it's fascinating. It really is. I mean, you could do 10 hours talking about this. I know you could, yeah?
Absolutely.
You know, do you want to keep that up on there now, Andrew, to show some more slides?
I was trying to switch back actually to the video, but I just can't figure that out.
If you just go down where it says, I'll tell you what it is, at the top, right at the top in a tiny little bar at the top. It just will say there, stop sharing, right at the very top in a little slither. See it, top of your screen?
Oh, I see it.
That's it. Yeah, I couldn't
I wasn't looking.
I couldn't find mine earlier on. That's why I know, I was like, where is it?
So what I'm doing to continue this research, because, I think it's quite compelling, and I definitely urge the audience out there that if you haven't seen the full slideshow presentation, that you can find it many places, including David Icke's website. You can find it on my YouTube channel, which is called Medicamentum Authentica. You should definitely take a look at that and see what you think of the evidence I present. And I list all of the references of where I found all that information so that you can verify everything yourself. But I'm continuing this research. It's ongoing, and I have several hypotheses about how I might give even more conclusive evidence that these are in fact the same thing. And I think there's a real possibility that this test, which is allegedly for COVID-19, is actually testing our own DNA.
Wow. I mean, that's an astonishing thought. And again, I can almost feel people's shock rising in the background. It's like, what? It's almost like you're telling us something's wrong. You're telling us that we're not being told the truth. I thought it was a very interesting thing you said about with Jamie. Well, I wrote it down here somewhere. I don't want to keep going back to Jamie's chat with you, but it is very interesting that you were saying that Trump and Fauci and everybody. Here we go. Yeah, they're sort of standing shoulder to shoulder. I mean, why would they do that? I mean, really, in one sense, you look at the British television and they're all standing and all the reporters are out of the way. And I do believe they're purposely trying to, I'll before we finish soon, I'll just have my little rant about that, why I think it is. But they're purposely trying to frighten people, in my opinion, to get some outcomes down the timeline, and which is happening right now. We'll see about that. But over there, why would they do that? Because they're saying how serious it is, Surely they'd be saying, look, don't do what we're doing. It's great leadership, but we're all standing pally close together and coughing on each other. That was fascinating. And what I also, if you could quickly brush on, that you did say to with Jamie, the fact that, let me just ask you then outright. Do you know nurses and doctors, Dr. Andrew, who are telling you there are not packed, overrun hospitals with thousands of people on ventilators, because that's what most people are thinking in the general public in England, because I'm hearing that that's not true. And then I also want you to just touch on, if you can, which is a very important point, that a lot of those beds in there that people would be in there normally, like someone like my father, for instance, who was dying of cancer, and they're not in there anymore. A lot of those people who are coming to their end times, who mostly die in hospital, you said this earlier, are now home, right, dying. Ooh,
yes, absolutely.
That's really a very, very thing. And these paramedics, there's no autopsies. Go on, if you could say that, because it's so important.
Yeah, sure. Well, let me just say about Dr. Fauci, because, it's pretty clear that Dr. Fauci knows that this is not going to cause major mortality, that he says it's basically just like a seasonal flu. And there's no reason to stay away from people on a typical flu year. So he's basically behaving based upon his own knowledge when he's up in public giving this talk with the president and other members of the White House cabinet. And that should be actually the strongest evidence of what he really thinks about things. Because if he's not displaying any fear or precautions, it's because he knows that he's not at risk of any new severe, terrible illness.
Wow.
Right? And, they tell us, right, do as I say, not as I do.
Wow. Yeah. And also the deaths. Like you said about the death numbers, no one's looking at them. I don't hear people talking about that on the news. I don't hear on the BBC, hey, the deaths this year, they're the same as last year. There's no more deaths. Talk about that. I mean, it's astonishing.
Yeah, well, that's how the public health officials actually find out if there's a new illness. Yeah. In this case, they didn't find out the typical way. Normally, they'd just be monitoring And if all of a sudden there's a spike in deaths somewhere in the world, they say, oh, let's figure out what's going on here. But in this case, that's never occurred. There's never been what they call excess mortality in any regions. There's always local variations from year to year because you can have environmental factors that might play into it. But there's really been no evidence. I mean, if you just think about the numbers, like 2 years ago, just in the United States, there were 80,000 deaths from the flu. That's way more than COVID-19 deaths this year. And in a typical year worldwide, you have something like between 500,000 and 800,000 flu deaths worldwide. And that's also way, way higher than the COVID-19 deaths. If you look at some other numbers, I mean, like heart disease and such like that, you'll see that it pales in comparison. I mean, really, there have been some analyses of the mortality that basically show that if you have COVID-19, you have the same risk of dying as a member of the general population. So there's really no evidence of a spike in mortality. Now, that being said, you know, in one hospital here or one hospital there, they might observe a few patients who are sick, but you can't generalize that to the whole pandemic. We're talking about a worldwide thing. Every country in the world practically is under house arrest to prevent this. I have heard from many healthcare practitioners, and many of the hospitals around the country are completely empty. And, you know, I've never experienced this in my career. You know, it's always been a bed shortage. It's always been hard to get people in the hospital. And so what they've done, and I know of several hospitals where they've done this, they basically took 90% or more of the beds and reserved those for COVID-19 patients only, and of which almost all of those beds are empty. And then a little sliver of beds available for the people that would normally be in the hospital, you know, people with cancer and heart failure and strokes and all the typical ailments. And so there's got to be this large number of people who don't have access to the hospital now, and which is where they would go and where they would die. I mean, if you go to a hospital on any given day, right, it's like you have all these funeral service trucks coming up and, you know, taking the bodies because, you know, a lot of people die. I mean, you know, in the United States, I think on a typical day, there's something like 8,000 deaths, right? And it's closer to over 100,000 worldwide, you know, every single day, right? That many people die. So that you could
my friend was actually one of the people taking the bodies out. Yeah.
Right.
Yeah. On a normal time, you know. Yeah.
Right. In a normal time. Yeah. So it's just, you know, that's how things go, because really the death rate for all of us is one per person, right? We're all going to die. There's no way around that. So there's a lot of deaths that occur on a daily basis, on a weekly basis, monthly, annually, right? That's normal. But we have to see, are more people dying, and are they dying of something, you know, unique or novel, or is this just pneumonia and there's the average number for a given year? But what's happening is, since these people don't have access to the hospital, they're dying at home instead of in the hospital. And you can imagine the effect that would have on the neighborhood, right? Like that you see, all of a sudden you see a dead body coming out of your neighbor's house, whereas you'd never seen that before because they'd always take them to the hospital. And I'll tell you, and I've heard from some paramedics that they've even changed their procedures on what happens when they arrive to a call where the person is, you know, either not breathing or their heart's not beating. So they're in, you know, in arrest, or they use CPR. And they used to do this extensive procedure. They'd never give up. They weren't allowed to pronounce someone dead on the site unless they had a doctor looking at the telemetry in the hospital. Now the first responder is told to give up CPR after a very short time and pronounce them dead. So basically that causes them to leave their home instead of in an ambulance and be pronounced dead at the hospital and go to the hospital morgue. Now they're being pronounced dead at home. So basically, you know, the morgue or the funeral service is going to come to the home and pick them up. So everyone in the neighborhood is going to see people dying. All of these first responders and paramedics are seeing many, many more CPR calls and more people dying than they're used to. And it gives the perception that more people are dying. And of course, because we're inundated 24/7 with the news cycle of COVID-19, we're going to just naturally attribute those deaths to COVID-19. And if we follow the CDC guidelines, we'll probably actually put that on the death certificate as well. So it gives this perception that there are more people dying of this. But what's actually happening is the same exact number of people are dying as last year. They're just dying in a different place. They're dying at home in their community rather than the hospital. And I'd say that there is a silver lining of this because, you know, then they can die around their family in a comfortable setting instead of in, you know, a sterile hospital with people with protective equipment that are afraid to touch them. So, you know, but that's not much of a consolation because the amount of fear that this is generating is driving everyone's consent to keep, you know, hiding at home under house arrest and being afraid of other people and living in fear, which is no way to live.
Oh God, Andrew, we're running out of time with you. That's the problem here. And I know we only had an hour, you know, but, you know, I just been writing things down yet, and imagine the anger of even someone listening to me questioning the authority, you know, and the facts. Don't you dare question this, you know. My mum, I can't see my mum. My wife can't see her mum, you know, and her mum's ill. She lives like I don't know, 250 miles away. It's absolutely unbelievable. If there's something happened, you can't go and see them. Well, I would. I'd drive straight up in the car. There's no doubt about it. Like, make no mistake. But, you know, when people say, I've lost my job, I've been turned into a beggar, I can't pay my rent. But all I'm saying to people is, hey, listen, just have a look. Because I could do a pantomime and put it on television every single night, Andrew, yeah? And I could do it. We could trick people, you know? And we could do all sorts of things. I'm not saying people are being completely tricked. As you know, probably, I had Professor Francis Boyle on my show at the start of all this. He was saying it's a bioweapon. And apparently American and that are still arguing whether it is a bioweapon or not. I am beginning to doubt more and more and more as I speak to people in authority who are saying this could be nothing. Can you imagine it? I mean, I'm almost tempted to say to you, Andrew, I don't want to put you on a spot, you know. I know you've got your foot in the door. It's a terrible thing to have to say to people. This could be nothing. Now, okay, everyone's going to say, before we go, I know, they'd never do that. Why would they do that? Why would they do that to us? This is a genuine thing. People are still, Andrew, believing that these people who are controlling this planet are like our mums and dads. They got their best interest in heart. And I know, I looked at this for many, many years, and I know that there's a dark agenda to shut people up when they're trying to wake up and strangle people with fear. It's paralytic to consciousness. And you're a psychiatrist. You know people's capacity to blossom into something so beautiful. It's just almost unimaginable, a world of total beauty, you know, without all this casino madness and mental asylum stuff. I know you can imagine that as a man who sees people in trouble. People are going mad. It's a mental asylum. So, you know, I think I've got to round it off and say this before I ask you if you've got anything else to say. I truly believe, I'm sorry to say, everybody, I've done enough investigation on this, that there's a horrible bunch of people who want a dark agenda for people on this planet. Microchips, Bill Gates tattoos, it's all already rolling out. And I think they're waiting and pushing. And when everyone's had enough and they're terrified and they haven't got much food and they've lost their jobs, you said it actually, Andrew. I wrote it down. I'm sure you said it. You know, people will almost accept anything. I'm sure you said that earlier on.
Yes, absolutely.
So, I don't know, anything else you want to say before we go, Andrew? Because we could talk all night here, I know, but, you know.
I have something that I think would be appropriate to close with, because, you know, I think as an individual, you know, human being, that we have a responsibility to pay attention to what's going on around us and to look into things for ourselves so that we can make our own assessment and make our own decision about things. When I started looking into this, I didn't have any preconceived ideas about what was going on. I just wanted to find out. And, you know, I figured, well, you know, I'm a doctor and I look at statistics, right? That's how you evaluate medical research. You look at numbers, right? You look at experiments. And so I just initially started looking at the mortality figures, and I said, wow, this doesn't seem like hardly any deaths. It's like barely a signal on the radar. And I said, well, why are they making such a big deal about it? And then I just started digging deeper, but I didn't come into it thinking that this was some kind of master plan or way to collapse the financial system or way to take away our rights. I just wanted to find out, is there really a dangerous illness? Do I have to protect myself from it? And as I looked more and more, you know, I found no evidence of a new disease, a new severe disease, or anything that you would be able to call a pandemic. What I found was something that seemed to be causing less disease and death than the typical flu, which is something that we don't really worry about, you know, unless you're a really, really sick person already. So I think after I've reviewed enough of the information and started to see that there's basically, you know, science that wouldn't even be published without a control group. There's inaccurate testing. There's these crazy policies that take away our rights, that are taking away our financial well-being and ability to prosper, right? Which is what many of our nations are built upon. That you can't help but think that there's got to be some reason for all this, and there's got to be some other agenda. And it's not a big leap of faith to say that it must be something about stripping away our rights and stripping away our resources and leaving us helpless and confined. And I don't know what the master plan is, or if there is one, but you know, if I were in the position where I would want to create a smokescreen to enact policies of global control, it would be much easier to fake an illness than to create a bioweapon. That would take immense effort and research. But if you could just have a public relations campaign that infiltrated, you know, science, medicine, public health, and the media, well, it would be pretty easy, I think, much easier, much less resource intensive to devise a plan where you just create the appearance of a pandemic, and then you use the fear to manipulate the people into accepting whatever policies fit your agenda.
Thanks, Andrew. And the Wizard of Oz obviously came into my mind now. Well, the curtains pulled back, and there's this little guy down behind there talking a lot of crap, you know.
Well, I see it as my mission is actually to be the one to pull back that curtain.
Wow, my God, what a mission! And I'll tell you what, you're pulling it back big time, yeah. And I really respect what you're doing, Andrew. You know, more and more people need to do this, and I know you'll be an inspiration to other doctors who are on the fence. Who, in my book, well, I got to show off my book before we go, obviously, because that's where the emergency transformation of human beings as the solution to the world's problems. It is the awakening that will save us. And this is, ironically, Andrew, part of the smelling salts, you know, that's actually bringing people around from the chloroform, you know. They say, hey, well, hang on a minute, you know, but right. And I think there's a lot in there. I actually talk to government and saying, if you're on the fence, come out now. And say, look, I can't stand this. I see something's wrong. So you're going to be a great inspiration. You are a great inspiration for so many people, to show people some courage to come forward, particularly doctors who've got a lot to lose, you know. And I love what you talk about, and thanks for your courage. And only up so recently, I'm still washing my food. I go to the supermarket, Andrew, right? I put it all in a bucket outside and wash every orange. It's driving me on the bend, you know. And I was starting to think, I'm not going to do this anymore. I think I'd rather die of coronavirus, you know?
Well, listen, the only thing you need to wash off the oranges is any pesticides if it's not organic. Otherwise, you're totally fine.
Absolutely, absolutely.
And I'm not, you know, like, you know, I'm not just saying this and then, you know, going outside wearing a mask and staying away from people. You know, there's no way I'm ever going to wear a mask, even if it becomes the law. And I'm not staying, I'm respecting people who want to keep their distance from me. I mean, I'm not going around and touching people and scaring them. But if anyone is willing to come in proximity and talk to me and shake my hand, I am open to do that. I want to connect with people. I want to show people that there's nothing to be afraid of. There's nothing that to catch. Even if you could catch it, there's nothing to catch. So there's no reason to be afraid of people. And I suggest that all of you, you know, hug your children, you know, hug your spouse, hug your mom, and become human again.
One of the things that I read, they said before we go, I'm sorry to keep going on, is that, and it's very important, they said on one of the papers, the best relationship is the one with yourself. They were almost saying, just masturbate, don't touch anyone, yeah? Oh man, I think they were alluding to that, you know? It's just incredible, incredible. Can people contact you, and also can people support your work with donations and things like that, Andrew, or not?
Well, I think in times like these, I would encourage people to hold on to your own money and, you know, save it for if things get much worse. But you certainly can contact me. I do offer natural healing consultations, and I've certainly been inundated with questions. And I'm just about to launch my website, hopefully in the next 24 hours, and there'll be a lot of resources there. And that is Andrew Kaufman, MD.com. That's Andrew, K-A-U-F as in Frank, M-A-N, M-D like medical doctor.com. And please check out my YouTube channel. It's called Medicamentum Authentica. That's M-E-D-I-C-A-M-E-N-T-U-M, Authentica, like authentic with an A at the end.
I'm just writing it down, so I'll go and have a look after it as well. Brilliant. Thank you, Andrew Kaufman, Dr. Andrew Kaufman, for everything you're doing. Like I said, and I know you'll be a great inspiration. And I know I've got to shut up now, but there will be people who haven't been born yet who will benefit from what you're doing now. Yeah, no pressure, right? No pressure. Okay. So thank you very much from those people down the timeline who are screaming at us, do something. We don't want to be born into prison with tattoos and microchips. So thanks very much, Andrew. Thanks for coming on the show, and thanks for everyone for watching. And please have a look at my work on my website.com. And, you know, thank you all for being so courageous to go through this. But in another sense, listen, there's a point where we've got to start questioning things. Don't just stay in your cage in your street like rats and rabbits and look out the window and think, oh, got to be a good girl and boy and be told what to do. Start questioning it. Start looking at things, because if you don't resist, the shackles will go clunking on your hands. And believe me, it's not going to go back. It'll always get worse. So it's got to be a line in the sand somewhere. So thank you, Andrew. Really appreciate you speaking with us today. Thanks very much for your work.
Yeah, I really appreciate you having me on, Jason. It's been a pleasure.
Yeah, lots of love to you. Thank you. Thank you, Andrew. Thanks, everybody. You take care now, right?